Hello everybody, my name is Ollie. I am a junior doctor living and working in England. Welcome back to my YouTube channel, and we're going to be trying something a little bit different just for a few videos. There's been a lot going on in the news recently. There's been some really high profile news stories, and I just want to put out a few rapid fire summaries of things that are going on at the moment and try and be as objective as possible, just to communicate a lot of this stuff and explain it in a context and a way in which it actually makes sense to, I hope, the majority of people listening. We have a very sensationalist news cycle, I think, in the UK, and some of these stories are actually really interesting, and I think they do deserve due diligence. One that I want to talk about today is that there have been some quite high profile cases of transplant patients being refused transplant operations due to their COVID-19 vaccination status. And those of you that are applying to medical school, I want you to really pay attention to this and think and reflect about these things, because often when we're applying to go to medical school and thinking about becoming doctors, you read a lot about ethical cases and difficult cases concerning transplants. This is a real world case, right? This is a case where doctors and surgeons have to make decisions about who gets organs and who doesn't, and this is how it plays out in the real world. So there are two cases that I want to talk about. The first is a Mr. DJ Ferguson, who is a 31-year-old male in Brigham and Women's Hospital in Massachusetts, which is one of the big teaching hospitals as part of Harvard Medical School. This man is on the list for a heart transplant, and it's been in the news recently. He's been removed from the waiting list to receive a donor heart because of his unwillingness to receive a COVID-19 vaccine. I can't find the exact details of the condition that he has, other than it is a hereditary heart problem that causes the heart and lungs to fill with blood. I'm not going to make guesses at this time about what exactly they mean by that. The second is a Mr. Shamgar Connors with stage 5 kidney failure, who has been on the kidney transplant list for 3 years. He's from Charlottesville, which is in Virginia, and he's made a very well publicised video claiming that the University of Virginia Health Board refused to give him a kidney transplant because, again, of his COVID-19 vaccination status. And again, this is an intense, emotive case of how these transplant cases actually work in the real world. The situation is that transplant patients are an incredibly high-risk group because they have to take immunosuppressive medication for the rest of their life to stop them rejecting the transplanted organ. And in this case, this is something called an allograft. That is a non-genetically identical member of the same species donating one organ or an amount of material to another. Because of this immunosuppression, transplant patients are at massively increased risk of developing infections and then doing very badly when they do develop an infection. And this is simply because by immunosuppressing them, which we do with very potent and specialist drugs, we have shut off the body's natural defense system, or at least part of it, the parts that allow you to mount an immune response. So if an opportunistic infection, a bug, a bacteria comes along, like I say, you can do very badly. How does this relate to these two specific cases? Well, as with all transplant cases, there are a whole litany of rules, behavioural regulations, things that transplant patients have to adhere to in order to be a suitable and good candidate to receive a donor organ. Because these are very complicated, very high-risk procedures which are extremely expensive, labour-intensive. They can only be done by very highly trained surgeons, can only be done in very specialist hospitals. So we do ask patients to keep up their end of the bargain and make sure that they're going to look after the organ properly. This includes things like being concordant with any medication regimes that they're already on or will be on after the transplant, stopping any recreational drug use, stopping smoking, stopping alcohol consumption, and being up to date with vaccination. And again, all of this does depend on the exact type of transplant and the organ that you're going to receive, as well as the country or the state that you find yourself in. Different places have different rules. But in any case, organs for transplant are an extremely, extremely limited resource. And we have a moral duty to make sure that those transplanted organs are going to the right people, these people that understand the responsibility of having a transplant, and that these organs ultimately go to the people who are going to get maximum benefit from those organs. And there are different ways we can think about that. But regardless of any of this, we know, based on the evidence we have, that transplant patients have a very significant risk of doing very badly if they are infected with COVID-19, especially if they're unvaccinated. Interestingly, in the UK, as far as I've been able to tell by doing my research for this, you can still be eligible for a transplant without a COVID-19 vaccine. However, it is still one of a larger series of data points that would feed into the decision that medical staff ultimately have to make when they're assigning organs. In these two cases that we're talking about, this heart and this kidney, these medical teams, these hospitals have decided that without the COVID vaccine, these candidates are less appropriate than others to receive an organ at this time. And just as a complete aside before this video wraps up, sometimes you hear people erroneously talking about being first on the list for a transplant. That's not really how it works, and it's an oversimplification of a very complicated process. You cannot be first on the list for an organ transplant. Every organ and every transplant situation is different and is assessed on its own merits. But I just thought these cases were a really interesting and stark example of medical ethics and decision making, specifically thinking about things like autonomy, utilitarianism and justice. Our patients cannot demand a particular medical treatment such as a transplant in any situation actually as it goes, and we have a duty to make sure that we do the best with the limited resources we have. It's not a fundamental right to be able to undergo a transplant, and if someone is unwilling to fulfill the rules and the regulations that apply locally to them, of course, surrounding transplant that would make them a good candidate for that organ, not just a good candidate, but the best candidate at that time, then it has to go to somebody else who will, and that is just the reality of how we have to make decisions. So I hope that's been interesting for you. Thank you very much for watching, and I will see you in another video.